the 10th of September. I'm Bernard Hickey for the Kaka. This is my video and podcast that goes out to paying subscribers to the Kaka, which is an email newsletter that looks at Aotearoa's political economy around housing, climate, and poverty. And one of the things that I try to keep an eye on is how much is being spent on things like housing and health and education to get a sense of whether publicly provided health, education, housing, that sort of thing, is helping to solve some of our problems. Now, one of the big issues we have at the moment is a stressed out hospital system. All sorts of nurses, doctors, specialists have left the system, often to go and work in Australia or just through burnout. And so you're having these big delays at emergency departments, big delays getting appointments and surgeries. And this is now the second biggest issue of concern for voters, according to the Ipsos NZ Voters Monitor. And one of the debates we're having at the moment is whether or not the government, through the public health system, is spending enough on health. The arguments has been that for 20 years or so, the governments, and of both flavours, have pressed down on growth in health spending, essentially tried to put a sinking lid on that health spending. So in actual number terms, the number seems to keep rising. But as a share of GDP, the argument is that it has not been rising and that it's been less than our OECD comparator nations. So less is spent on healthcare here than overseas. Now, simply spending less doesn't necessarily mean that you get less, but it's a good indicator. And there's clearly something going on here, given what we're seeing in the health system now. But you may have heard the government, and Simeon Brown, the new health minister in particular, pushing back at this idea that New Zealand's health system is underfunded. He believes that there is plenty of money going into the health system and a lot more than was the case previously. He says that New Zealand's health system spending has risen to 11% of GDP, and that this is higher than the OECD average of 10% of GDP. So he's saying to people, no, you're wrong. We haven't underinvested in health and we're spending plenty. And when you come to me to ask for more, I'm just going to say, hey, you're already getting more than your fair share. So remember those numbers, 11% of GDP, says Simeon Brown, versus the OECD average of 10%. And he's saying, talk to the hand, you're already getting enough. But a new report has come out from public finance academics at the University of Auckland, a report commissioned by the Associate Salaried Medical Specialists Union. So this is the union for doctors working in the public healthcare system. And it has found that the numbers that Simeon Brown and Health NZ are relying on for that 11% are just plain wrong. And he is essentially gaslighting the public on health costs to GDP. So I want to show you through some of the results of this report and then go into some of the implications for the wider economy and our society. So there's Simeon Brown saying that, and he actually said this in Parliament when accused of underfunding the healthcare system. He said that was, quote, fake news. And he says, no, look, New Zealand is the light green line there. We had a big increase in health funding during COVID. We're now above the OECD average, and you need to go away because you've already been given enough. However, this report finds that that claim of 11% is based on data that stopped being provided to the OECD in 2018. And that means New Zealand's healthcare system is not contributing to the OECD database, and that this claim of 11% is based on essentially a baseline of 2018 data, and therefore is not comparable with the OECD. We haven't sent data to the OECD since 2018. So when you adjust the numbers for this, which is what this report has done, it turns out that our numbers are more like 10% of GDP, which is in line with the OECD, as opposed to 11%. Now, comparing countries' health systems like for like is actually quite difficult. Many have a lot of private healthcare insurance, which tends to inflate the cost to GDP. Others have a lower level of service for public health, which makes it not comparable. So the public health finance experts have looked through the detail and come up with some better measures. And they've also pointed out that the New Zealand figures relied on by Simeon Brown include GST in some of those measures. So essentially inflating the reported cost, that 11% number that is in there. So that's including the private sector and ACC, who do charge GST. And this is not something that happens in other countries. Healthcare is not included in value-added tax or GST measures. So when you look at that, you can see that New Zealand's revised estimate is back down near that OECD average level. The other thing to keep an eye on is that trying to compare New Zealand with the OECD can be slightly dangerous, because the OECD got hit hard by COVID in 2020 and 2021, whereas our healthcare system didn't. However, it did get hit through late 2022 and into 2023 as COVID raced through the population and a whole bunch of people were hospitalised. And of course, we stopped wearing masks and got the cold again. So what you're seeing here is that the COVID spend was backloaded, if you like. So when our number goes up to 10% and seems to match the OECD in 2023, that's partly because of inflation from COVID spending, which by then the rest of the OECD did not have. And that, again, inflates the number that Simeon Brown is using to say that there is no problem. So just in summary, therefore, New Zealand's spending on health, and that includes both public and private, is around about 10% of GDP in 2023, and not 11%. And that's significant. We're talking about more than $2.5 billion here in spending. And rightly, the healthcare academics point out that it's really 20 years of underfunding that has led to all sorts of stress on staff, people leaving, not being paid enough. And again, it's all about this expectation we can do more with less, we can keep squeezing it, and that we have to keep healthcare costs squashed down if we're going to keep the size of government under 30% of GDP. Again, I don't think that's realistic in a world where we have an ageing population and various healthcare crises, including obesity and mental health, which are increasing the share of GDP that has to be spent on health. Now, why are New Zealanders so unhealthy? Why are there so many people struggling? Well, a new report out in the last day or so from the Salvation Army has looked at food insecurity, i.e. how many people are hungry, and looked at this claim we often hear from farmers that New Zealand feeds 40 million people with all its farming. Well, it turns out the Salvation Army says that there's about 1 million people in New Zealand who are regularly hungry and having to use food banks. And there's a chart there that shows the food security indicators as pointed to by the Salvation Army, and that more than a quarter of households with children now are reporting that the food has run out often or sometimes, and that they're eating less because of it. And nearly 15 to 20% of people are using food banks. That's not a healthy society, and perhaps contributes to some of the stress that's flooding through into our healthcare system, not to mention some of the issues we have around education, performance and productivity. And as we've seen from a new report out by Ngāi Tahu's Whānau Ora Commissioning Agency, the result of this underfunding in health has really hit some more than others. So Māori people are twice as likely to die from heart disease as the general population, almost twice as much for suicide, more than twice as much for lung cancer, and ischemic heart disease for women are twice as much. So you get a sense there from that chart and from the report, which I include a link to in today's email newsletter, that our current healthcare system is not working generally. It's also not working in a really unfair way on Māori and Pacifica in particular. And there's a whole bunch of reasons for that. Just to give you a sense, this is the overall death rates for lung, colorectal and liver cancer. This is Māori being the dark bars and the light bars in that chart being non-Māori, and clearly in some cases more than double the rates of cancer deaths per 100,000 individuals. Another area, female ischemic heart disease, again, related hospitalizations, and you can see there the rate just on double for ischemic heart disease and just under double for angiography. So again, these are the expensive, difficult diseases, ones where if you don't keep on top of them early, you're going to have to end up in hospital. If you can't afford the appointments or you're too late on the list, you're going to get hit, and that disproportionately affects Māori rather than non-Māori. Now, the other big report that's come out in the last day or so is from the Business Forum on Health and Safety. This is a group of employers set up by John Key, actually, in the last decade, to look closely at improving health and safety in Aotearoa. Obviously, in the wake of Pike River, we changed the health and safety laws, and we know that we're very poor compared to other countries when it comes to preventing workplace deaths and injuries. Well, every year the Health and Safety Forum comes up with a report, this year produced by Shamubeel Jakob, looking at the cost of accidents, not just to the nation, but also to businesses in terms of lost hours worked and productivity. And what they've found is that in the last year, we have seen a significant increase in the amount of harm. Essentially, all of these costs add up to have gone up over the last couple of years by about $1 billion to $5.4 billion. So not being health and safety conscious and not spending money on the technology and the training that you need does cost you more. And of course, a lot of these injuries will flow into the healthcare system and again, put extra stress on it. To give you an idea of how bad we are, New Zealand's death rate in the workplace is 1.7 times that of Australia. Now, it is lower than it has been over the years. You can see a couple of spikes there, one really big one in 2011-12, which of course is the Pike River disaster. But you can see that we haven't fallen as fast as others. Our rate is 1.7 times the Australian rate and 6.5 times the rate of deaths in the UK. And part of the reason for that is because we have a real churn economy. A lot of people leave their jobs and a lot of new people come in, many of whom aren't experienced, and they're more likely to get hurt in a workplace accident. So some really interesting figures here from Shamubeel. 41%, that's 1 million people, have been in their job for less than 1 year. And for those people who are new to their job in their first year, only 10% came from the same sector. So if you've got someone working as a tradie or working in a mine or working in a warehouse, more than 4 in 10 of your staff are new staff, are from another area, that's going to increase your accident and death rate. And it just goes to show the nature of our churn and burn economy and the large numbers of people flushing in and flushing out. And of course, just to emphasize the effects on who rather than the total numbers, these numbers are from the Health and Safety Forum report showing that Pacific and Māori people are more likely to be injured in the workplace. And the rate for Pacifica is about twice that of the, for example, the Asian rate and twice that almost twice that of the European rate. And the Māori rate is also significantly higher than both European and Asian workers. So there is a wider issue here. Now, just finally, a bit of economic news that's come out in the last day. We got a report that the manufacturing volumes and construction volumes fell in the last quarter, the June quarter, and BNZ, after these numbers, have updated their forecasts for the June quarter. They now see a 0.5% fall. So that's a return into a contracting economy after a couple of growth quarters, and is part of the reason why there's such disillusion amongst the broader public with the direction of the country, and of course a change in the polls to put the opposition ahead, at least in the last two polls. I'm Bernard Hickey. That was today's chorus for Wednesday, the 10th of September. My apologies for not producing one yesterday. I'm traveling at the moment, but we'll be back on track tomorrow. And if you happen to be watching this and you're not a paying subscriber, that's because I've been asked to open this up by those paying subscribers who want me to do a lot of this work, this journalism, looking at the political economy around housing, climate and poverty, and putting it into the public domain for reading by all and sharing by all.